Hi everyone, our subject today is ataxia. In summary, essential of diagnosis, acute cerebellar ataxia, post-infectious syndrome of children 2 to 6 years old, most common infection, varicella, rubella, rubella, enterovirus, polio, Epstein-Barr virus, and influenza, involving trunk and extremity. Normal CSF and head imaging, most common cause of ataxia in children. Ataxia develop over hours to days after prodromal illness, nystagmus, slurred speech, difficulty with fine motor movement, truncal titubation, gait instability, should not have altered mental status, seizure, or meningism. Friedreich ataxia, autosomal recessive gait ataxia develop before puberty, diminished reflex, position, sense, and light touch, dysarthria, cardiomyopathy, diabetes mellitus, Biscavus, and scoliosis develop over time. Most common hereditary ataxia, progressive ataxia of all extremity. Dysarthria is common, sensory loss, particularly vibration and proprioception. Posterior column, dorsal root, and peripheral nerve are affected. Eventual loss of deep tendon reflex. Ataxia telangiectasia, autosomal recessive disorder, defect in ATM gene. At first, infant appear normal, may learn to walk on time. By age 2 to 3 years, ataxia appear and then progress. Typically require wheelchair by 15 years. Oculomotor apraxia, patient cannot make fast voluntary eye movement, so he or she turn head instead. Telangiectasia on eye and skin typically appear after age 3 years. Immune deficiency, frequent upper and lower respiratory tract infection with a decreased level of immunoglobulin and T cell dysfunction. Increased risk of cancer, often leukemia or lymphoma. Progressive pulmonary disease, infection, interstitial lung disease. Serum alpha-fetoprotein are elevated. Polymyoclonus opsiclonus, lightning-like jerking of extremity, truncal ataxia, jerking, irregular eye movement, irritability, emesis occur after infection, often beta hemolytic streptococcus, and with the neural crest tumor, usually begin a benign ganglioneuroblastoma. Dominant ataxia, autosomal dominant disorder of CAG repeats. 10% of patients present in childhood. Ataxia progresses to ophthalmoplegia, extrapyramidal septum, polyneuropathy, and dementia. Differential diagnosis of ataxia, mimicker of acute cerebellar ataxia, drug effect like phenytoin, phenobarbital, primidone, lead intoxication, infection, corticosteroid withdrawal, CNS vasculitis like polyarteritis nodosa. Polymyoclonus opsiclonus may look like acute cerebellar ataxia until the eye movement are recognized. Ataxia is feature of untreated Wilson disease, ataxia telangiectasia, Refsum disease, Rett syndrome, A-beta lipoproteinemia, vitamin E deficiency, gangliosidosis, Chidag-Higashi syndrome, Charcot-Marie-Tooth disease. Peers. Differentiating ataxia from motor weakness caused by CNS disease, infection, myopathy, and trauma may be surprisingly difficult in children, especially in frightened toddler.